Best in Ohio.
You know what? If you start, I'm gonna say it's okay. There's either a mask on what we're talking about. They won't hear what we have to say.
All right, okay.
Do it now, Don.
Good idea. Should we like hang them at the bottom?
Yeah, I hang mine right here. Pictures on your American flag.
All right.
That's a good optic.
Oh, Jenny.
Take your mask off, Don.
I'll just hold it.
We're not ready yet, are we? I'm waiting on these guys.
Okay.
Okay, okay, great. Well, good morning. Thank everyone for coming. On behalf of my fellow commissioners, Commissioner Rogers and Cindy Carpenter, my name is Don Dixon. And this is just one of the multiple briefings we've had with the Health Commissioner, Jenny Baylor. She's here with us today, and she's going to be delivering all the information that's going to be, I believe, more pertinent than what we have to say. Ours is introductory, and she's the person that has all the numbers and the info. I know the last 6 to 8 weeks have been hard, missing special moments with our friends and family, going to work and praying that your loved ones come home safe and healthy. And because of their sacrifices, though, we're here today to enjoy the restoration of part of our county. It'll take some time to get back to where we were as family and finances and business and as community. Butler County is strong and resilient, and all of you matter. We have a short program this morning to continue to promote physical distancing. Most of the media has elected to view this via live Facebook, and that address is facebook.com/TV Hamilton, Ohio. TV Hamilton, Ohio. Got to get that all in there. In a minute, Health Commissioner Jennifer Baylor will provide an update on current statistics of the virus and relevant information you need to know and practice as Ohio and Butler County restores many of the much needed services. Butler County will remain focused on protecting our citizens, businesses, employees, and employers, and although the economy is restarting, we will continue to practice those best habits which allow us to enjoy today. Physical distancing, good hygiene, washing your hands, sanitized surfaces regular and frequently. We hope each and every one of you will continue to practice these measures. As Ohio begins to restart Ohio, the county too will begin to restore its operations. Butler County services and all of its elected officials were never closed. Something of which I'm very proud of. All of our office holders continue to serve and provide meaningful and much needed services during the stay-at-home orders. Our elected officials are some of the best people and most dedicated public servants around. I would like to now turn this over to our Health Commissioner, Jennifer Baylor, who's done a wonderful job. We appreciate her very much, and she will give us the new information. Jennifer.
Thank you, Commissioners. I appreciate the opportunity to speak to the public today. I have a few things that I want to say. I will say from the start that we're not going to talk about exactly what's happening at the state level today because it's changing by the minute. So if you want to know exactly what Dr. Amy Acton's orders are or the governor's orders are today at this time at 9:30, 9:40 in the morning, please stay tuned to the state because that's changing rapidly and we would not want to give out inaccurate information. I do have some local information to give you today, however. The total number of cases of confirmed COVID-19 in Butler County that have been reported to the Butler County General Health District and the City of Hamilton Health Department and the City of Middletown Health Department is 257. We've had 6 deaths since we started the reporting. 26% of our cases were hospitalized, and again, 26% of our cases occurred in clusters. Those clusters were either in homes or in workplaces. We are seeing an increased number of clusters as reports come in and we make connections between this case and that case, and we expect to see more clusters in the future as this outbreak rolls along. Our cases continue to go up in the county. Our cumulative total continues to be on a curve like this, or a line like this. So we have not flattened out yet in Butler County. We look for that to happen. We hope for that will happen. We're not surging at an exponential rate, but we have not flattened out as much as we would like in Butler County. I have some numbers about race for you. This has been mentioned at the state level, and I'll give you the local Butler County numbers. 52% of the cases reported to us were white, 45% were non-white, and the rest were unknown race. In our county, we have between 80 and 85% white. So if 45% of our cases were non-white, that means that they're occurring more often in non-white populations. I have a couple of questions that have been asked, well, I have several questions that have been asked a lot of our staff, and so I want to provide an answer to these. Will Butler County be doing anything to monitor enforcement of retail employees wearing face coverings? Or will Butler County only respond if there is a complaint? The health department and district does not envision themselves as being the mask police. We would like for people to wear masks. I remind people whenever I go out, but that's because that's who I am. We will respond if there are complaints. We don't have enough staff to go out every day and monitor every business as it opens up and make sure that people are wearing masks. That's one reason why we have press conferences, is to remind you this way and to ask you to be good citizens and participate with us and with your fellow citizens in doing the things that protect the health of Butler County residents, and that is to wear a mask. I have a few words about why we wear masks in case you haven't heard this yet. A lot of people can spread this disease before they show symptoms. So if you want to say, well, I don't feel sick, so why should I wear a mask? I hope that you don't become sick. But many people who do become sick were capable of spreading the disease before they showed symptoms. So a mask, like I have here, helps to decrease the amount of secretions or droplets that come from your mouth and your nose to protect the people around you. Wearing a mask, in my opinion, is a gesture of goodwill towards other people that says to them, I don't feel sick now, but if I happen to be sick and I don't know it, I don't want to spread it to you. So I'm going to wear a mask to keep my secretions and droplets to myself so I don't spread them to others. Recent studies have shown that this disease can spread through talking and singing and just the normal things that we do. So we do, as a health district, advocate wearing masks, and that's the reason why. Other questions have come about contact tracing. You have probably heard that as we ramp up testing in our county and our state and our nation and make available test kits so that wide testing can be done, excuse me, the number of people who are identified as positive will rise. When that happens, that puts a big surge on the public health district because we have to investigate every person who is positive and ask them where they've been, who they've been around, what they have done in the critical period when the infection could have spread. For every positive test result that we receive, it generates approximately 20 phone calls from our staff. And that could mean calling and not getting an answer, waiting for a call back, calling again, not getting an answer, waiting for a call back. So 20 successful calls plus all of the other unsuccessful calls are generated by every positive test. Then when we do reach those contacts, we have to put them in quarantine. It takes a lot of time, a lot of personnel to do all the contact tracing that is required. So we want testing to ramp up, and we want to increase our contact tracing because that means we can isolate or quarantine people who are sick or may be sick and keep everyone else healthy. But that does cause a big surge on the public health system. And I've been asked how many people we have doing contact tracing currently. And we have around 11 or 12. Many of them are part-time, filling in hours here or there in addition to their regular job. Let me do a quick count. 1, 2, 3. I have 4 full-time people dedicated to contact tracing, and then the additional ones are here and there as they are able. We will be bringing on 10 new staff members. They will be volunteers. They are medical students and public health students who will be helping us with contact tracing. That will probably cover us well for the next 2 to 3 weeks. As testing ramps up more, we know that we will have to bring on more contact tracers as well. So if you would like to volunteer for that activity, you can send a note to the General Health District. We are particular about who we bring on as volunteers because we need those people to have a particular skill set. So happy to take volunteers who have that skill set if you're interested in doing that. A slow reopening is necessary to prevent a surge on hospitals. We have successfully, as the public, averted a surge that we've explained to you is what we did not want to see happen, and it hasn't happened because you all have done the right thing and stayed home when you could. You've worn masks, you've practiced good hand hygiene, and you've social distanced yourself or physically distanced yourself from other people. But a slow reopening is necessary. We need to do this gradually. If we jump into this and abandon all of those good practices that you've learned how to do and are doing so well, if we abandon them all at once, then we will have the surge that we have been fearful of. So do your part and stay apart. Handmade masks are important for the public to wear. There will be hot spots and outbreaks. We've seen several of them over just this week alone, and we will be responding and surging resources to those areas. Hospitals will take care of people who are ill. You don't need to be afraid to go to the hospital right now. If you are ill, you should go to the hospital. And I'm talking about if you're ill with something other than the COVID-19 virus. If you have other health needs, please go to your healthcare, call your healthcare provider and go to the hospital if you need to get the care you need. Let's see. Other questions that have come in have to do with, for example, will my neighborhood or apartment complex or city pool be opened this summer? Right now, opening of pools is not in the director's order. Pool operators may open towards the end of the season, but we have not received exact guidance on that from the state. It's not one of the things we look towards as opening anytime soon. What happens if one of my employees tests positive for COVID-19 and they have been at work? If an employee tests positive for COVID-19, then the health department or health district where they live is required to be notified. The positive employee will be contacted by their respective health district where they live and will be placed in isolation where they will stay until released by that health department or district. The health department will do a contact investigation to determine if additional people need to be quarantined or isolated. I've had a lot of conversation about graduation ceremonies, and I've worked with the superintendents in Butler County to come up with a plan that we can all live with, and we are following the governor's instructions for safe graduations. I have asked anyone who's not doing a virtual graduation to discuss with me their plans so we can ensure that all of the boxes are checked to require this health and safety issues to be taken into account. I can tell you that the superintendents here are very creative, and they have come up with some super plans that will allow seniors to enjoy their graduations and family members to be proud without endangering the public's health. A question says, I've seen lawn care companies out in my neighborhood mowing yards, mulching, planting flowers, and spraying chemicals. Is this essential? A recent decision by the Ohio Department of Health and the Dispute Resolution Commission has determined that all lawn care is essential and can carry on. So you should be glad to hear that our outdoor will look nice this spring as things start to bloom. I want to show you the curve from our epidemiology report. Since this is a video, I'm going to hold this up in just a moment. Our epidemiology report comes out every week on Thursdays, and you can find it on the Butler County General Health District website. You can Google that and go there on the COVID-19 section of the webpage and go down to epidemiology report. So this comes out on Thursday. And I want to show you the top part of this page. And this shows our case count. This is our cumulative case count in the dark line that you can see. And this shows that our cases are still increasing. We're not out of the woods yet. So I'm advocating the practices that you all know about. So those would be wearing a mask, checking for fever and symptoms and staying home if you have them, practicing good hand hygiene, and staying away from other people, okay? I want to talk just a minute about being a leader. This is a difficult time to be a leader and take a stand and stand by that. I've had some blowback in my own department from people who didn't think they needed to move their desks apart, for example. And I want to say, if you are a leader in your community or in your home or in your business or in your sphere of influence, this is the time to practice those skills that good leaders have, which would be to stand tall, stand firm, square your shoulders, and take what comes to you as a leader. Make the difficult decisions that will keep your people safe and healthy, and be a leader. We need many leaders in this community to stand tall as we move slowly back to being open again. We want people to get back to work. We understand that businesses need to stay open, and we support that. The public health system wants that to be done carefully, thoughtfully, and intentionally, and using the things that I've already mentioned, which are please wear a mask, stay apart from one another, stay home if you are sick, yike, and practice good hand hygiene. Those are the things we would like for you to do as we slowly reopen. And the health district supports reopening. We're a small business ourselves. We want to see that happen. So those are all my comments for today. Yes, we have one question here. So there have been several situations in long-term care facilities across the whole state, across Southwest Ohio, and Butler County is no different. The public health system, especially our director of nursing, has worked closely with every single nursing home in our jurisdiction to make sure that they know all of the things that they need to do according to the CDC to practice good infection prevention. Our EMA has made sure that every long-term care is well-resourced with the personal protective equipment that they need in order to protect their workers. They should be reporting to us any positive COVID tests that they receive or that they suspect are happening so that we can intervene as quickly as possible. So we're working very closely with all of our facilities to mitigate the impact of this disease. We know that it will happen. And as I said earlier, we expect that there will be hot spots and places where we need to put out fires, and we're prepared to do that. We're going to be forming strike teams to go out from the health department when there are issues at long-term care facilities and get to work on those just as soon as we're notified. So we'll have people ready to drop what they're doing and make phone calls and make sure that there aren't any unmet needs in those facilities. But we do know that COVID-19 will happen there. I will tell you that across Southwest Ohio, there's a movement to open up what are called HCICs. They are healthcare isolation centers, and they are long-term care centers who have chosen to specialize in COVID-19 persons, and they have sort of an advanced level of infection prevention and knowledge, and they have agreed to take these people on purpose so that they can care for them well and send them home. That decreases the chances of this disease spreading through a number of previously healthy residents and making them sick. If we can cohort the sick people together and cohort staff who have specialized knowledge to take care of them, then we are doing that. So we do have one in Butler County, and we look for others if they're interested to also step up and do that. So those are all my comments for today. Thank you very much.
Let me just simply thank everyone for coming, especially the media. Thank all of our residents and all of our business owners who have cooperated with our health department and our request to keep everyone safe in Butler County. And I'd like to say a special thanks to Jennifer Baylor, who her and her team have, in my opinion, done a magnificent job putting in some tremendous hours and truly looking after all of our better health. So at this time, I'd like to thank everyone for attending and wish everyone to stay well. Thank you.